Okay, so now we're going to start talking about little lesions, and so little abnormalities or differences in the makeup of our skin. One is the macule, and I classically think of freckles when I think of macules. Again, remember we're looking at characteristics like, is the lesion a certain size, color, shape? So is it flat or round? And then is there any kind of a filling to it? So kind of like classifying pastries, right? So if we're looking at a macule is going to be small. It's going to be smaller than a centimeter in diameter. And so that means roughly smaller than like the end of your pencil or of your eraser cap on a pencil or something like that. And a macule, by definition, is going to have color. It's going to have pigmentation because it's basically a melanin spot. So it's a cluster of highly crowded melanocytes that are just pumping up a lot more melanin in that little region than the skin cells around it. And these would be freckles or like liver spots, age spots, beauty marks, those sorts of things, so long as they are flat and continuous with the skin, that they are dark and restricted to the epidermis, so the basal layer and above, and smaller than a centimeter. If they become larger than a centimeter, then we have to call them a patch. And typically they're not very dangerous. They're just, they're really benign or non-harmful, especially if they are a macule and smaller than a centimeter. If their margins are smooth, if they are not changing in shape or texture, if they've been there for a really long time and not changed, and that they're pretty uniform in their color. These are spots that are fairly normal variations in skin. It's when they start to change their border. It's when they start to grow. It's when they have irregular color throughout. It's when they appear and increase in number and in size. Then we start to be concerned, and we probably should look at that with a dermatologist to make sure that it's not a form of melanoma or skin cancer. Next type is a vesicle. And so think of a blister. Typical blister. A blister would have like a bump, so it would be raised over the surface of your skin, and it would be filled with like gooey fluid. And usually a blister is going to be like clear, right? So when you look at a blister, you can kind of see through the surface of the skin to the goo inside, and you can tell that it's kind of clear fluid. So a blister that is smaller than a centimeter. So if you have a blister and it's teeny tiny, it's smaller than the top of your pen eraser, then we're talking about a vesicle, okay? And vesicles tend to pop up in small little clusters, but a vesicle is a teeny tiny little micro blister. So filled with clear serum. We see these in fever blisters. We see these in diseases like shingles, right, which is a close cousin to the chickenpox virus. So if you ever had chickenpox virus, you also have the virus in your body that causes shingles when you become older. So this affects individuals usually older than 60 or 65. There is a vaccine for it. So when you reach that age, or family reach that age, it's really important to go out and have that shingles vaccine to prevent this outbreak, which is kind of the more benign symptom that can also be associated with pain, nerve damage, open wounds and sores. So these open up to create ulcers and can be quite painful and irritating. All right, and then now let's talk about acne. Acne is another form of little lesion, and these come in two main varieties, the papule and the pustule. Okay, they sound similar, but look at the second one, starts with pus, so it tells you exactly what's in it. So these look the same. They're the same size. They're less than a centimeter size, so, eraser or smaller. And they're both red and they're both raised, so they have a little hilltop or a little mountain top. The only difference is the papule is going to be just red, and the pustule is going to have white pus right at the surface. So you can tell there's pus in there, right? So here's a pustule, and here is a cluster of mostly papules, right? Mostly little red bumps with the occasional, here's like a white head, so there's a pustule, and here's a white head, so there's a pustule. Why are these clustered together? Well, because papules can sometimes, in the case of acne, turn into pustules over time. And sometimes papules and pustules are terms that we can use to describe any small bumps that are red or small bumps that contain pus. So these can be associated with allergic reactions and rashes as well. If we're talking about just acne, though, the reason that we have these bumps is because we have an infection in the hair follicle, usually because bacteria fall into the pore, and then our sebaceous gland is supposed to create oil to push that back out. But if that pore gets plugged, then that bacteria stays in there, and we produce more and more oil, and both the oil and the bacteria have nowhere to go, and so they build up and create pressure. And that creates inflammation, and we get a papule or a pustule. Altogether, we might have a family of acne, which we could call Comedo. And a Comedo is basically the form of acne that we would associate with blackheads. And blackheads, we have kind of different names for what these are, but a technical blackhead would be if you have that pore plugged with hardened dark sebum. So if that oil became wax and then closed up this hole, then you actually have a technical blackhead. If that sebum still maintained a softness and created a plug that then led to infection in the sebaceous gland or in the pore, then we would create kind of a soft white head with a whitened appearance at the pore. If that white head or Comedo continued to grow, it would mature into a papule, and we would have that red raised bump that we know so well as acne and irritation, and then that could turn into a pustule. Lancing these or squeezing these is usually not a great idea because we can rupture it to the surface. That creates a portal for infection. But also because if we're just using our fingers, those aren't very specific tools, and that can back release pressure and infectious agent laterally into the spaces of the dermis, and that can spread infection into other follicles and pores that were not affected originally. So if you notice that you have a breakout and you pop them and then you have more in that area, that could be the reason why. Well, this is not to say that you can't pop pimples, and there are professionals who do this, but they have specific tools that help them to do that, and they also know how to isolate so as not to cause irritation and rip the sensitive layers of the epidermis and cause scarring. Right? There's two forms of acne. Acne vulgaris is the kind that teens get, and it affects your faces, shoulders, and back. And acne rosacea, which middle-aged individuals get, and both of these are due to changes in hormones. So as your hormone levels go up, we get an increase in sebaceous gland activity, and we see some crazy activity around clogged pores and acne. As those hormones start to decrease at the tail ends of your reproductive years, we see the second kind of outbreak phase. Although it's not normally as bad, it just covers your face if you do get it, and may be associated with a little bit more redness, but doesn't tend to spread all over other parts of the body as well. So fun facts about acne and little lesions. Stay tuned for large lesions.